We're going to be talking about interprofessional care. Interprofessional care refers to the collaborative practice among various healthcare professionals. This idea focuses on the importance of teamwork and shared values when providing care. The three main areas that athletic trainers focus on are education, collaboration, and practice. Interprofessional education is when two or more professions learn with, from, and about each other to improve their knowledge and quality of care. The approach is essential in preparing healthcare professionals to be able to work effectively with each other, which leads into collaboration. This is a team-based approach where professionals from different practices of profession work together to help enhance patient care. An example of this would be an athletic trainer working together with a team doctor to help figure out the best plan of action for their athlete. Interprofessional practice is effectively using your IPEC competencies in your everyday practice to be able to work with other healthcare professionals to be able to provide the best care for their patient. An example of this could be the inner workings of an athletic trainer and EMS at a sporting event when an athlete needs to be transported to further care by EMS. Tommy is going to further explain the IPEC competencies and team-based competencies.
Okay, so here we have your interprofessional education collaborative competencies, and you have your four core ones being values and ethics, roles and responsibilities, team communication, and teamwork. First, you have your values and ethics, which is what you value as a team member and a team as a whole, and what you think is overall the most important thing that you need to do. And then you have your ethics, which would be your moral obligation and what you think is most important for you and the team to be obligated to do first if something happens. And one of the team-based competencies that falls under that would be mutual trust, because you have to have the trust that your team members have the same values and ethics that you do when it comes to that type of emergency situation. Next, you have roles and responsibilities, which is roles being knowing what you are responsible for and knowing what you need to do in a certain situation. And you as a team member are responsible for knowing what your other team members are also responsible for and what their roles are, so that you can work together in the best way possible. And then next you have team communication, which is being able to collaborate and talk with your team members in a way that is efficient and effective, so that you can provide the best care in the fastest manner possible without having to worry about slip-ups, mistakes, or overlooking something that would be easily misunderstood. So some things for that would be closed loop communication, which would be if I ask you to go get an AED and you respond with, okay, I'm going to go get the AED. Then you have good team communication, you know what you're doing, and you know that that's what they're going to do. Next, you have teamwork, which is a lot of these things like backup behavior and mutual performance tracking. And those are things like being able to work together in, again, the best form and fashion. With mutual performance tracking being something like having a meeting post cardiac arrest where you meet with your team members and you talk about what you could have done better, what went well, and what you probably need to improve on. Another thing for teamwork and team communication would be backup behaviors, where you have somebody discussing in the background of you performing CPR about needing to do something to improve, like your chest compressions not being deep enough and something like that. So those two, your team-based competencies, play directly into your IPEC competencies, and they are both overall very, very important in order to be interprofessional.
So I'm here to talk about the quintuple aim in healthcare. These are just kind of some foundational pillars that ensure that we as clinical practitioners are delivering the best care with the best goals in mind for our patients and the healthcare system that we work in as a whole. So first, we're going to talk about our patient experience. We want to make sure that as people who operate interprofessionally, we're collaborating with other healthcare workers to make sure that our patients are receiving the best care, that they believe that they are being listened to, that they are agreeing and compliant with the treatment care plan, anything along those lines. Second, our job is to make sure that we are advocating for population health. Our job to care for people does not just end at an individual patient level, but rather extends onto a broader group of individuals, communities, and population-based health. The third is going to be reducing cost. Healthcare is expensive, especially in the United States, so it's important that we are working interprofessionally with other healthcare providers to make sure that we are not ordering an abundance of tests, doing unnecessary rescreening, doing unnecessary referrals when we have a special test that we could provide to then not only reduce the burden on the healthcare system itself, but also reduce individual burden on patients and families. Fourth is going to be care team well-being. It's important when you're working interprofessionally to check in on your peers that are part of the workforce, making sure that they are feeling like they have all of the resources at their hands to be the best that they can at their jobs, whatever that may look like. And then lastly is advocating for health equity, and this is just making sure that everybody has equal access and opportunity to receive the best care that they are all deserving of having from us as clinicians.
In addition, when you're working on an interdisciplinary team, you want to customize care and manage smooth transitions across settings and over time, even when the team members are in entirely different physical locations. You also want to coordinate and integrate care processes to ensure excellence, continuity, and reliability of the care provided. You also want to resolve conflicts with other members of the team and communicate with them in a shared language, even when the members are in entirely different physical locations as well. When working on an interdisciplinary team, you want to learn about other team members' expertise, backgrounds, knowledge, and values. And you also want to learn individual roles, processes that are required to work collaboratively. You also want to demonstrate basic group skills in things like communication, negotiation, delegation, time management, and assessment of group dynamics. And you also want to ensure that you're being accurate and timely with the information that you're trying to reach for those who need them at the appropriate time.